Hello, my name is Debra Murillo, and today I'm going to be discussing diabetes mellitus. I decided to do this research on diabetes because my family has an extensive history of diabetes, and it is something that I wanted to do more research into, as well as because this is a growing issue for many people and a lot more people are getting diagnosed with this disease. And it's something that I think more people should be educated on and know more about. So, what is diabetes mellitus? Diabetes mellitus is commonly known as diabetes and is a chronic condition where the body cannot produce enough insulin or can't effectively use the insulin it produces. It will lead the body to produce abnormal high blood sugar levels, and insulin is a hormone that is produced by the pancreas, which helps glucose, which is blood sugar, enter cells for energy. If it is not properly managed, it can lead to life-threatening health problems. There are different types of diabetes. Type 1 diabetes is when the immune system attacks and destroys insulin producing cells in the pancreas. Type 2 is when the body either does not produce enough insulin or cells don't respond to it properly. And lastly, there is gestational diabetes, which can only occur during pregnancy and can increase the risk of developing type 2 diabetes later in life. So, some history of diabetes. There's actually a significant amount of history, which I actually did not know about. I thought it was more of a new disease that just started, like not that many years ago, but actually it goes all the way back to thousands of years ago, from ancient description of symptoms all the way to the discovery of insulin. Evidence was found in ancient Egypt, Indian, and Chinese medical text that was not fully understood. Some symptoms that were stated in the ancient text, such as excessive urination and a sweet taste in the urine, which are believed to be related to diabetes. They also noticed ants would attack urine of some people, but not others. It wasn't until 1776 British chemist Matthew Dobson confirms that those who have diabetes contain sugar in their blood and urine. Around the same time, it was when scientists began identifying the pancreas's role in diabetes. When they removed the pancreas from dogs, it would cause diabetes, proving its central role. Canadian scientists Frederick Banting and Charles Best began to research and isolate insulin from pancreatic extracts. And this is them pictured in this photo right here. And by 1922, the first successful insulin treatment is administered to a 14-year-old boy, Leonard Thompson, which saved his life. He's all as well pictured right here. This was the 14-year-old boy with the diabetes and insulin saved his life. Banting received a Nobel Prize in physiology for the discovery of insulin. By the 1950s to 60s, there was a development of synthetic insulin and oral medications for type 2 diabetes. And from the 1920s to 2000s, insulin pumps, continuous glucose monitors, and new classes of medications such as metformin are being produced. Before all these were produced, people would only live a few weeks or even months with the disease. Uh, Type 1 diabetes, as I mentioned earlier, there are multiple types of diabetes, all of which come with different causes, risk factors, and treatments. Signs and symptoms of type 1. Diabetes can manifest including frequent urination, excessive thirst, extreme hunger, rapid weight loss, fatigue, and blurred vision. Symptoms can appear suddenly, especially in children. Primary treatment for type 1 involves insulin therapy, which replaces the insulin's body, the insulin the body no longer produces. This would include multiple daily shots of insulin administered through injections. Insulin pumps are used to continuously deliver basal dose of insulin, and different types of insulin are used, including rapid or short acting. Type 1 diabetes is considered an autoimmune disease because of the body mistakenly attacking its own beta cells in the pancreas. Although typically type 1 presents itself in childhood or adolescence, it can occur at any age. This type requires daily insulin injections or a use of an insulin pump. As pictured right here, this is an insulin pump for an adult and an insulin pump for a child. The reason why the insulin pump for an adult is different than the ones for the children is because pumps for children are designed with features specifically to their unique needs. These pumps have the ability to deliver very small and precise doses of insulin. You don't want more insulin than what you need because then your blood sugar will drop low and you could get very ill and possibly even pass away if your blood sugar is too low. Type 1.5 diabetes is a less discussed form of diabetes and which is also known as the latent autoimmune disease in adults, LADA. This form shares the characteristics of both type 1 and type 2 diabetes. Similar to type 1, it's an autoimmune condition that develops most often in adults. This is where the body's immune system attacks the insulin producing cells in the pancreas. A drastic difference is the process is slower than type 1 diabetes. Often with type 1.5, it gets misdiagnosed as type 2 because of its slow onset. Genetic and autoimmune are risk factors for this type and is considered to be hereditary. Further research is ongoing to better understand the genetic basis of this condition. This type has the same symptom as type 1. Treatment for this type involves a combination of oral medications and lifestyle changes initially, but many individuals eventually require insulin therapy. Type 2 diabetes is the most common form of diabetes, and it is specifically characterized by the body's inability to use insulin properly, leading to high blood sugar levels. Type 2 is different than both type 1 and 1.5 because it can be developed over time, and lifestyle factors like obesity and inactivity is one of the main cause of the body's inability to effectively use insulin. Being overweight is also another large risk factor for developing type 2 diabetes. Family history and genetics can also play a factor into the uh, risk fac risk factor of developing the disease. It can run in families, meaning you're more likely to develop it if someone in your family has it. But if you take preventative measures, you're less likely to end up with the disease. This type often develops in adulthood, but it is increasingly seen in younger people. The reason for this is a combination of factors, and including rises of obesity, predisposition, rates of sedentary lifestyles, and potential genetic factors. Maternal diabetes during pregnancy may also increase the risk of their offspring developing type 2 diabetes later in life. And lack of physical activity can cause weight gain, increasing the risk. And ethnicity also plays a role. Indians, Hispanics, and Asian individuals have a higher risk, studies show. Gestational diabetes. This form of diabetes only develops during pregnancy and it typically presents itself around the 24th week. The reason for this is because the body struggles to produce enough insulin to handle the increase, or I'm sorry, the body struggles to produce enough insulin to handle the increased blood sugar levels. The drastic difference between gestational diabetes and type 1 and 2, it is not caused by lack of insulin, but rather by hormones from the placenta, making insulin less effective, called insulin resistance. When it comes to the symptoms for gestational diabetes, there is often no notable symptoms, although in some cases, women may experience increased thirst, frequent urination, or fatigue. Managing the disease would include healthy eating, regular exercise, and possibly insulin or other medications. Most women's blood sugar levels return to normal after delivery, but those who have had it are at a higher risk of developing type 2 diabetes. Prioritizing nutrient-rich foods like fruits, vegetables, and whole grains, limiting sugary drinks, processed foods, and excessive carbohydrates. There is some research that suggests that mild and stool supplements might reduce the risk, but more research is needed. Some main symptoms, the main symptoms of any type, both type 1 and 2, or even 1.5, and gestational. The most common ones would be frequent urination, increased thirst, extreme hunger, slow healing wounds or cuts, and unexplained weight loss. Some of the more severe symptoms that can be life-threatening or just threatening to your daily life would be nerve damage, kidney failure, amputations, and blindness. Some of the geography behind diabetes, so there are geographic variations in socioeconomic status can contribute to the rising rates of diabetes because research shows that areas experiencing greater poverty and lack of access to healthcare resources have higher rates of diabetes. Different lifestyles and nutritional patterns also factor into the risk of development of the disease. Studies show that living in urban areas and large cities can increase the likelihood of development of diabetes compared to rural areas due to the factors like access to food and exercise opportunities. How to get diagnosed? Typically, you can get diagnosed with diabetes through blood tests that measure blood sugar levels. The most common tests include the A1C test. An A1C test is where the test measures your average blood sugar over the past 2 to 3 months. If your A1C is 6.5% higher on two separate tests, you are likely to have diabetes. A1C between 5.7 and 6.4 indicates prediabetes. These tests help to determine if you're within the normal range, pre-diabetic, or diabetic. Prediabetes is a warning sign that your body is becoming less efficient at using insulin. Unlike diabetes, prediabetes doesn't cause noticeable symptoms. Many people are unaware they have it. With lifestyle changes like weight loss, exercise, and healthy eating, can often reverse its progression. The prognosis for each individual varies based on how well it's managed. Generally, it's lifelong, although there is no cure. Those who have the disease can often can control it through lifestyle changes. Untreated high blood sugar can lead to serious complications such as heart disease, stroke, kidney disease, and nerve damage, impacting the quality of life and shortening lifespans. There are multiple factors that influence the prognosis, including age of diagnosis, the progression of symptoms, and other pre-existing health conditions. At age 50 and over, life expectancy is generally shorter in comparison to those without the condition. Those who do not take care of themselves, who have the condition, can worsen and live a difficult life. Some notable people that I wanted to mention that have been diagnosed with diabetes are Nick Jonas, who is a musician, that was diagnosed at a young age. Many people remember when he was diagnosed, especially people that are my age, because he went on Disney Channel and talked about his condition. And this is where a lot of people actually, at a young age, began to learn about what diabetes is. Tom Hanks, best known for his roles in infamous movies such as Forrest Gump, was diagnosed with type 2 diabetes in 2013. Halle Berry is a known actress who was diagnosed with type 1 diabetes at age 19, which led her to make healthier lifestyle choices. Jay Cutler, the former NFL quarterback, was diagnosed with type 1 diabetes as well. My own family history is a lengthy one. Um, it has gotten to many of my family members. Um, my grandmother had type 2 diabetes that developed over around her 50s. She was on insulin, but her diabetes was still uncontrolled, which caused her to develop severe complications. Her kidneys began to fail due to her uncontrolled blood sugar levels, which led her to dialysis for many years. And it did lead to her untimely demise at only about 60. She was in her 60s when she ended up passing away. And my mother also suffers from type 2 diabetes, which developed after her pregnancy with my mother, or I'm sorry, my brother, which had just she had gestational diabetes, which then developed into type 2 diabetes at the age of 31. After taking metformin, her sugar was still uncontrolled, so she had to go on insulin. And my father was recently diagnosed with type 2 diabetes at the age of 61 and is now starting medication. 4 out of 6 of my siblings have been diagnosed with type 2 diabetes. One of my siblings was 14 when she became pre-diabetic. Multiple aunts and uncles of mine, on my mother's side, all were diagnosed with type 2 diabetes over the past 2 decades. I also have a brother-in-law that has type 1.5 diabetes, which caused him to have a drastic weight loss and he had to go on insulin, which has been difficult to manage. That is another reason why I wanted to look into type 1.5. I know a lot of people do not know about that type of diabetes. It's usually just type 1, type 2, and the gestational. And but 1.5 is a scary diabetes to develop because it just happens out of nowhere, and it's something that he got when he was already older, and it's been very difficult for him. Um, some key takeaways I wanted to discuss is diabetes is a manageable disease if the patient takes proper measures for the sake of their own health. Although both type 1 and 1.5 are not preventable, type 2 can be avoided if you eat properly and exercise the way you should be. Diabetes is not something anyone wants to live with. It is a daily challenge and can impact the day-to-day lives of those who have it. I grew up with many people who are close to me having this disease, which gave me a firsthand view on how difficult it can be when you don't manage your blood sugar levels. Overall, diabetes is still a disease researchers are trying to get more information on and develop medications that are safe and will help all those who are diagnosed. Approximately 537 million adults 20 to 79 years old live with diabetes. That number is expected to rise to 853 million by 2050. Thank you for listening. I hope that you get a better insight onto what diabetes is and how many lives it does affect all around the world, and for how long it has been affecting people's lives. It's not something that developed recently, but it is something that has been an issue for hundreds of years. I hope you enjoyed. Thank you.